All right, everyone, I'm in Houston, Texas right now visiting Dr. David Alfi so that I can learn more about jaw surgery and specifically about Dr. Alfi's method of doing jaw surgery, which is using these pre-printed custom titanium plates that allow Dr. Alfi to do his jaw surgeries in a fraction of the time that a normal jaw surgery occurs in. So for example, yesterday, which was Monday, my first day here in Houston, I shadowed Dr. Alfi and witnessed him complete 3 MMA surgeries with genioplasty. So 3 patients, double jaw, Lefort, BSSO, and genio. 3 cases, 1.5 hours each, all in one day, while the surgeon in the operatory next door did 1 surgery in that same time. And mind you, Dr. Alfi and I had 1-hour breaks between each surgery. So 3 surgeries plus breaks, lunch, coffee, etc., all in the time that the surgeon next door, using the traditional MMA surgery methods with bending plates on site, completed 1 surgery. So when I had interviewed Dr. Alfi last year, he told me that he did these MMA surgeries in between 1 and 1.5 hours. And to be honest with you, I thought that was an exaggeration. I thought maybe, okay, he had done a surgery in that time, but that wasn't necessarily every surgery. But it turns out every single one of the procedures we did yesterday was under 1.5 hours. It's not that, we were racing to get the job done in an hour and a half, but he moved extremely quickly, and the pre-printed plates allowed not quite plug and chug, but it is a kind of plug and chug. I mean, there's not a lot of discernment that's needed during the surgery itself. All of the discernment goes into the planning of the surgery. So more on that later, and actually on Thursday I'm gonna film some surgical footage, but that's just my impression from my first day in Houston. Yesterday watching those 3 MMA surgeries. By the way, my mind was absolutely blown seeing this process happen. I'm not gonna lie, it's exactly the way I had envisioned it in my mind. The anatomy, seeing the maxilla break off, watching the mandible advance. Another observation I can make just now while it's still fresh in my mind is that before the first surgery, Dr. Alfi pulled me aside. He said, hey, if you start to feel squeamish, especially as I do the Lefort cut and break the maxilla down, make sure you back up to a wall, sit down, chill out, don't forget to breathe, because you might faint, having never seen this sort of gore before. But what I found was that my reaction to seeing the surgery, the blood, the bone, the dust of the bone being cut, the skin being lasered back, wasn't disgust or shock. It was actually fascination and amazement. I wasn't seeing destruction, as you might think when you see these bones being cut. I was seeing creation. And all I could think to myself was, damn, I'm jealous, man. I want that. I want to feel that transformation of having that maxilla advanced and rotated and that mandible pulled forward. I mean, some of these advances we were seeing were 2 centimeters on the mandible with genio. It completely redefined my understanding of what is an over-advancement and what is an appropriate advancement. I mean, these 2 centimeter advancements on some of these patients looked perfect. So I have to say my paradigm about what is the right amount of advancement is changing now that I'm hanging out with Dr. Alfi. I'm starting to come to terms with the fact that my sense of aesthetic and my sense of beauty is that I like prognathic faces. I like big advancements. I'm not insecure about taking retrognathic jaws and slamming them forward so that they look super alpha after. I like the Julia Roberts look. And I'm coming to terms with that, because what I'm learning as I try to parse out the jaw surgery space is that one of the big differences between jaw surgeons and anyone who spent time on Reddit, subreddit, jaw surgery, etc., Facebook, they know that the main criticisms that some surgeons get. For example, Dr. Alfi has a reputation, over-advancing. And you hear that and you're like, oh shit, I don't want to be over-advanced. But I guess what I'm saying is I am more inclined to that end of the spectrum. I'm not of the opinion that smaller, more modest advancements that have you looking more like the norm or the average American face, that is somehow more aesthetic. And so it really is kind of a subjective thing. And that's where I'm starting to think that I fall on that question, is liking more rather than less. So anyhow, I digress. I'm about to go into Dr. Alfi's office. We have patients coming in today for pre-surgical appointments. These are potential patients that just want to talk to Dr. Alfi about, are they a candidate for surgery? What kind of surgery might he perform for them, etc., etc. And yeah, super interested to see that. Maybe gonna work with Dr. Alfi's staff a little bit and see how they conduct their operation there. Okay, so I'm about to walk down out of my hotel here in Houston, Dr. Alfi's clinic, which is right down the street. It's separate from the hospital, which is the Houston Methodist Hospital. Dr. Alfi's main office is in a separate building, and let's head down there right now. Let's go, let's do this. Dr. Alfi.
Good morning.
Hey, good morning. So the way it works when you come visit Dr. Alfi is that you stay at either the hotel I just stayed at, which has a relationship with his office, which is the Westin, and it's literally a 2-minute walk from the hospital, which is right up here. So you stumble out of your hotel room, and you walk down to, the hospital is right here, and then Dr. Alfi's office, where you go for your consult, is just 1 block down from there. So it's all within walking distance, and it's all very convenient. So, fuck, I forgot where his office is. Oh shit. All right, so I actually just walked by it. It's this building over here. A lot of glass. Yup, 6624 Fan and Tower. Let's try that. Yeah, this looks familiar. I was here yesterday between each surgery. Dr. Alfi's office is on floor 17, and we're finna go up there right now. All right, this is the spot. So you can see in here, Dr. Alfi had this mural done recently, which is Mount Rushmore, but they all had jaw surgery. So they're all looking very prognathic, very alpha. Pretty dope. And that's the same person who did his Kobe mural, which was in the background when I did the Zoom interview with him last year. All right, so let's go on in. That's Houston. One thing that always shocks me about visiting down south, Midwest, certain parts of the United States, is how flat they are. Look at that sprawling flat plain. Incredible. You will not see that in the Northeast.
Hey, how are you?
All right, it's 7 p.m. Just finished up a full day of shadowing Dr. Alfi. We saw a bunch of follow-up patients, consultations, post-op, pre-op, a little bit of everything. Then to wrap the day, Dr. Alfi had his personal trainer come and absolutely destroy us with a tough leg workout. Dr. Alfi actually has his personal trainer come at the end of every day. So he's kind of a freak in that way, where he'll do 3 surgeries in a day, and then he'll have his personal trainer come and destroy him, which, maybe that's the type of mentality that it takes to become a jaw surgeon, is you gotta just go hard 24/7. Hard at work, hard working out, hard, go, go, go. But, he asked me to join, and actually he asks all of his staff to join, and I wussed out from yesterday's workout after 3 surgeries, but not today. Today I brought my gym clothes and I smashed it with Dr. Alfi, so let's go. Pretty proud of myself on that. All right, so yesterday I completed day 2 of my shadowing with Dr. Alfi, and it was a clinic day, which is to say that we saw a bunch of patients in office, pre-op patients, post-op patients, consultations, and then some non-jaw reconstruction related stuff, which is pretty minimal for Dr. Alfi, since mostly these days he's turning that stuff away, things like implants, etc., and focusing on jaw surgeries, double jaw surgeries, advancements. Although one woman did come in with mandibular tori, massive lumps of bone on the inside of her mandible, which Dr. Alfi explained to me, and I didn't know this, that is actually caused by bruxism and is indicative of a small airway. When you clench down, the bone responds to that new load by growing more bone, except in inappropriate places. On the inside of the mandible or on the maxilla, actually she had both. Big bony masses, almost mountains, were forming, so much so that they were blocking her airway even more, causing more clenching, causing them to get bigger, so it's kind of a runaway train, and Dr. Alfi is going to remove them for her. Obviously, this woman was also a candidate for double jaw, but that's not a conversation that was had, since that was probably way outside of her paradigm and she was just focused on getting the tori removed. Anyway, it was an incredible day. I learned a lot about interviewing patients, having a sustainable demeanor so that you can see 15 patients a day. Dr. Alfi is very chill, very calm, very stoic. He keeps an even keel. That's probably the number one thing that struck me about Dr. Alfi personally. Something had happened yesterday. There was some sort of scheduling issue where a patient was supposed to come for surgery, but the plates hadn't arrived to do her surgery, and some of the team members here were really upset about that, because obviously, think of how disappointing that might be for the patient, that they had come, had mentally prepared for the surgery, but that the plates, for whatever logistical reason, hadn't made it. And people were upset, staff members were upset, but Dr. Alfi sort of just came in, calm, cool, composed, and figured it out. They solved the problem. They tweaked accommodations to make sure the patient was happy. They moved some things around so that they could get the patient in right away as soon as the plates came in. And I think what I'm saying is when you look at a surgeon, there's a thing I'm noticing recently, which is that the psychoanalysis of these jaw surgeons it's important, and we all sort of do it. We want to know who these people are personally. Like someone told me that Ben Wallin will bring research papers about jaw surgery out to dinner, like he's the proverbial geek, right? Obviously, surgeons are known for their massive egos and whatnot, and that's cool. But what's really struck me about Dr. Alfi's personality is, just his cool, calm, composed demeanor, which you want in a leader, but you also want in a surgeon. Because imagine something goes wrong in surgery. Do you want someone who's going to get anxious and freak out and get all frazzled and his hands shaking? No, obviously not. You want someone who's going to maintain his composure as the storm rages around him. And that's definitely what I'm seeing in Dr. Alfi. And I'm learning a lot from that, because at this point in my life, as a 34-year-old, as a business owner, as a father, a husband, a YouTuber who's constantly subjected to ridicule, criticism, it's important. It's an important level of maturation and understanding to be able to control yourself and control your own mind in that way, and to just have a pace about your mind that's sustainable. So today is Wednesday, my third day of shadowing Dr. Alfi. Early in the day, we're going to see a post-op patient who I had referred to Dr. Alfi, who did his surgery last month. I think he's 5 weeks out from surgery. This was a patient who was strongly considering a MARPI expansion before surgery because his problem was poor nasal breathing and just general fatigue. You know, he was treating the jaw surgery as a kind of biohack to just uplift himself, feel better, breathe better, sleep better, look better. And to be honest with you, I was trying to talk him out of doing the surgery. I told him, you should do the MARPI first. Since what you're looking for is nasal breathing improvement, maybe you should do that before the jaw surgery, because jaw surgery isn't really known for getting you super good nasal breathing improvements. It does improve nasal breathing, but not as directly as a MARPI does, as it expands your nasal floor. And he actually this patient overruled my recommendation, and I'm curious to see how it turned out for him. I think the difference is he had met Dr. Alfi, where I had never actually met Dr. Alfi in person, and Dr. Alfi had assured him that his way of reaming out the nasal bone, the spurs at the base of the nose, right underneath the septum, would open up his nasal airway. And when the patient told me that Dr. Alfi told him he would do this and that it would negate the need for the MARPI, I kind of called bullshit on that. I was like, sounds kind of gimmicky. But on Monday, I saw Dr. Alfi do that for 3 patients. He literally takes the saw and he will shave a couple of millimeters of bone at the base of the nose, and always in double jaw patients, you see a tremendous constriction in the nasal aperture. And he would point it out to me. He would say, look how narrow that is. While the patient was open there in front of us, he would say, let's open that up. And he would take his saw and he would just ream out slices of bone off this thing, which was incredible. Maybe I'll get some footage of that tomorrow when I film surgery. But curious to see how it worked out for this patient. How's his nasal breathing improved? We're gonna find out. And then other patients in the clinic today, just gonna be another day of excitement and intrigue and learning. I'm learning a ton, and that's really what I'm here for. Yeah, okay, kind of I'm here for the footage and for getting JawHacks content, but what I'm really here for is to learn. That's the most important thing for me as a patient advocate, as someone who actually helps coach patients through the landscape of airway procedures, jaw surgery, orthodontics, etc. That's what I really care about, is learning. So more of that to come today, and then of course Dr. Alfi's personal trainer to come in probably around 6 p.m. and smash us again. Last night we did a leg workout, and man, I pooped out after 2 sets of squats. My hamstring started cramping up. She was pushing us. She wanted ass to ankles on the squats. She's tough, but it's interesting that Dr. Alfi surrounds himself with people that push him. I definitely don't do that. I'm very much a recluse. I sort of depend on myself to push myself, but I'm learning also as well that maybe to function at the level of a maxillofacial surgeon who does 9 double jaw surgeries a week, maybe that's an important thing. You need to bring in that peer pressure element, positive peer pressure, surrounding yourself with people that push you. Definitely Dr. Alfi's team, they're all super sharp, all on point, and are pushing him to be his best. Yesterday, another thing we did was I watched Dr. Alfi do surgical planning, and that is also a teamwork effort. So he has his brother Johnny start the process, then he'll jump in and tweak Johnny's plans, and then they get on the phone with a company that further does digital planning, and then Dr. Alfi works with that person as well to finalize the plans, and then the plans get sent to the custom plate maker. And in all parts, Dr. Alfi is being pushed in this sort of dialectic way. Hey, Dr. Alfi, what about this? What about that? So he's depending on other people to bring his energy up, which is cool, and which is something I want to incorporate more into my own life and way of doing business and way of doing creative work. Anyway, I gotta get to the office for 9 a.m. to meet this patient with Dr. Alfi, and so I'll leave it at that, and I will check y'all soon. Peace out. All right, everyone, I'm at the George Bush International Airport, about to fly home from Houston to Boston after spending Monday through Thursday with Dr. Alfi, and I just wanted to sort of sign out and give you some of my personal takeaways from the week. Number one, in-person interviews are much different than Zoom interviews. I haven't done many in-person interviews, just Ilya Lipkin once and a myofunctional group, but all the rest of my 60 whatever JawCasts have been through the internet. And while it's good, you can get information on the internet and it works, it's better than nothing. Doing it in person hits different. That sort of human connection, being in the room, making eye contact, it allows for sort of a connection and a vibe that's on a whole different level. And I think it's sort of at this point in my career in JawHacks, it's not that I'm getting bored of the Zoom stuff, but I think the spice of the in-person interviews is very motivating to me. I can see it getting me to get up and be inspired to create more content and sort of go out and learn more information on behalf of the channel. So definitely an eye-opening experience on that front. Number two, traveling in general is very motivating, and I think it's good to get out and get out of your comfort zone, leave your nest, and shake things up with some travel. I mean, I'm reclusive by nature. I can go days at a time not leaving my house. Sometimes I won't even fill up the gas in my car, and it's a Mini Cooper with a 10-gallon tank, for a month or more. I mean, I don't get out much. You might be surprised to hear that, but I'm very much a homebody. And I think when you do that, you can get sluggish. I think that your mind gets sluggish, you end up in a rut, you end up losing motivation. It's good to go out and make contact with the world, and to remember your place in the world, and remember that there's this bigger place out there outside of your little nook where there's human beings that live different than you, and that, for me, it's motivating. It reminds me that, okay, I got this channel. These are the actual people I'm reaching beyond just the YouTube analytics. I think I just need to get out more, is what I'm saying. Even if it's not traveling on an airplane to a new city, even if it's just getting out in my hometown to a cafe or whatever, to a library, going into Boston once in a while. I live outside of Boston, driving in 35 minutes, taking the train into the city, and just getting a new perspective. I would encourage anybody who has that homebody inclination like me to shake things up. When I boarded the airplane in Boston to come to Houston, I seriously almost deboarded the plane. I got cold feet. I was like, fuck this. Flying sucks. I'm claustrophobic. I gotta pee. What am I doing? You know, I can interview Dr. Alfi on Zoom again, et cetera, et cetera. But I'm really, really glad I didn't do that, because that would have been totally bitching out, basically. So I think that anytime you have a resistance like that, it's basically the devil's last effort to get you to bail on something that's ultimately going to be a meaningful experience, which this definitely turned out to be. All right, my last takeaway, because I got to go board. It's cool to think about jaw surgery and about jaw expansion and about jaw hacking at a theoretical level, but to see it in person, it's a whole different thing, man. Seeing that maxilla get dropped, seeing the doctor go in and do those BSSO cuts, seeing the plates, seeing all of it. It's just like seeing surgeons in their flow, you know, in the zone, communicating with each other, going at that fast-paced, ultra-focused, seeing the patient's face be transformed in real time. It's important, I think, for me, as someone who is a purveyor of jaw surgery and orthodontic expansion related information, to make sure that I don't become too much of an armchair philosopher. Years ago, I was definitely in the thick of it as a patient. I was undergoing the procedures myself. I underwent my own MSC expansion. I felt the appliance in my mouth. I felt the split. I talked about the split, the pain and suffering involved in the split. I was a foot soldier at one point a couple of years ago. I mean, now I'm in Invisalign, et cetera, et cetera. I'm almost done with that. But the last couple of years, I've very much assumed more of a sort of theoretical, journalistic role from the armchair, from behind the computer screen. And I think it was very, very good for me to go out and see patients in clinic, to see the surgery in action, for whatever intangible reason. I can't quite put my finger on why it's important that I did that, but it definitely feels important that I did, because my level of understanding now of jaw surgery, which is a major procedure, obviously, I guess you could say maybe like I've earned the right to talk about it now, not in an arrogant way, but like, I don't know if you can really be a jaw surgery influencer, so to speak, someone who talks about jaw surgery for a living without actually ever having seen one. And so I can now check that box and say that I've been there, I've had blood splashed on me, not really, but like, so to speak. And yeah, shit was real. Shit was real. And definitely gonna seek out more experiences like this. I would like to visit a surgeon who did more traditional plate bending, on-site plate bending, just to see the difference. I mean, I wanna go through that 3, 4, 5, 6, 7 hour experience as opposed to the 60 to 90 minute Dr. Alfi experience, because I think that would be a whole different thing too. And I want to see how plates are bent in real time, just for curiosity's sake, almost from an academic perspective. I mean, that's what I do, right? I'm someone who helps inform other people about what's involved in these surgeries, and I think I owe it to myself and to you guys to get the full spectrum on jaw surgery by maybe seeing a more traditional surgery. Maybe Dr. Gunson or Dr. Casey Lee would have me for a surgery at some point. All right, I'm gonna get on this flight back to Boston. I'm gonna go home, see my wife and daughter. I miss them very much, and I'm very grateful to have had this opportunity to visit Dr. Alfi. Grateful to Dr. Alfi himself for letting me be attached at the hip to him for 4 days straight. I hope I didn't annoy him too bad, but no, I think honestly I have a new friend now, and I'm grateful to him and his whole team, and glad I was able to get you guys this new content. All right, checking out, flying home. Peace out.